much. We appreciate your time. The last and final presenting CEO today is Stephen Krein of OrganizedWisdom. Stephen.
Wow, the last. I think I'm officially the last guy up, so I'm standing between you and your cocktails. My name is Stephen Krein, and we've actually done something pretty unique. We've actually created a new way for people to use the internet to solve their health problems. And very simply enough, we really just do it using experts. Now, a lot of people say, what do you mean by that? So how many people in this room have actually ever sat with a doctor or another health expert and searched the internet? And I'm looking and I see one hand, and my guess is mother, brother, somebody in the family is a doctor. Because like me, I have a brother who's a doctor in the family. It's the only time I've ever had the chance to do it, up until I started OrganizedWisdom. And it struck me absolutely in a mind-boggling way that when you search the internet, you're alone. You actually go to a scary Google search box and you start typing. Or you go to WebMD. And so you either have one or two experiences that occur. You either are alone, you're frustrated, but you realize at that moment that you're sitting in between So you're sitting in between a gap, and it's kind of an interesting gap, but on one side you've got WebMD, which, and no offense to WebMD, it's great, but it's encyclopedias and dictionaries. And quite frankly, it's the same one on Yahoo, AOL, MSN, and Everyday Health. So you're literally looking at repackaged encyclopedias. So it's great for the what is and the simple stuff. And on the other side, you've got billions and billions and billions of pages. Most searches have 1 or 2 million results in them. And so if you don't have an expert sitting next to you, maybe the first search is okay. But once you start really getting into it, it's overwhelming and you find yourself in this gap. And we realized it's important and how big of an opportunity it could be if we filled this gap. Now, I'm a young guy, relatively young guy, just turned 40, and so I haven't fortunately had any real life-threatening things happen to me, but a few years ago, a very close friend and mentor of mine, Ian Berg, was diagnosed with pancreatic cancer. And Ian was actually one of our investors, actually and a board member in my last company, Promotions.com and Webstakes.com, which I started in New York City with Dan Feldman, who's a co-founder of OrganizedWisdom as well. We took it public and then sold it to iVillage, and Ian was very instrumental during that process. And when he was diagnosed with pancreatic cancer, he and his family, mostly his family, went and did the same thing I described. They went to Google, they went to WebMD. Got scary stuff at Google, like you got 90 days to live, and they went and found the medical literature and started to have some hope, but really couldn't make any sense of it. And that was the opportunity we saw. We couldn't believe that in 2007 and 2008 and 2009, that we couldn't expect more from the internet than a Google search box and a WebMD encyclopedia that's been repackaged, that's actually just Adam or HealthWise. So we actually tried to set the bar a little higher, and we said, let's actually create a health graph. Let's start with the basic foundation of content, right? WebMD, blogs, social networks, all kinds of great things, medical literature. That's the foundation. We know it, everybody uses it every day. Search, Google, Yahoo, Bing, you can kind of search all the content you want all day long. And the beautiful introduction of the last couple of years of Twitter and Facebook and even social networks like Patients Like Me, where people are connecting. But it's still a do-it-yourself experience. It's mind-boggling that the person who's diagnosed with pancreatic cancer today, unfortunately, will do the same thing that Ian Berg did 3 years ago, the first time he learned of his diagnosis. It's a scary Google search box, and it's WebMD. That's pathetic. So while all these companies are coming together to do lots of nice features, we figured that a health graph built on top, where you can bring health experts, doctors, health practitioners of every sort, shape, and size to the table, and layer a level of intelligence to content and to search, and create an experience that actually isn't so scary and isn't so overwhelming and isn't so frustrating. And our vision of the world is that you can bring experts to the table in a meaningful way, in a free way still, and provide them with the guidance they need while they're using the internet for their health problems. So what did we do? We got 5,000 now vetted experts contributing to Organized Wisdom, and over 1 million people every month are now helped by the experts that we've organized and vetted at Organized Wisdom. Now, we built a scalable technology, because you got to say that at a VC conference, and that's wonderful. But what we're really proud of is that we've been able to deliver this service for free for consumers. And we're doing that because we've got clients and advertisers like AstraZeneca and Shire and Bristol Myers Squibb and Glaxo and Lilly supporting the efforts of these contributors, helping people be guided to the best online resources. And we're not anywhere close to being done, but we've assembled an incredible team that knows how to actually take it to the next level. So, as I mentioned, I brought the team with me. So Unity Stokes and Dan Feldman started Organized Wisdom with me. They're up here in the front. We IPO'd, that's actually 10 years ago, look how young we were. We IPO'd our company on NASDAQ in September of '99. And we realized then, and it was a direct marketing and technology company, and today McDonald's and Kraft and Nabisco used our technology still, but to do something more impactful, we had to go and do something more like bring experts to this table to change. So we went to WebMD and got the best person there who built their contributor network of 10,000 physicians to come on board. Now, this is all wonderful and everything, but and I gotta step back for a second and say this because we're doing something so much more meaningful for me. I mean, I've gone through the company life cycle, startup, IPO, sell, hire, fire, done it all. And I've raised over $100 million of capital from venture capitalists and angel investors and strategic investors, both in the public market and the private market. I've done it. This time around, I want to do something more meaningful. So I didn't let a dollar of money come into Organized Wisdom that didn't have like-minded souls, people who believed that we were doing something more meaningful and that could help us. And Esther Dyson was the first person that popped into my mind. She thinks big and she recognizes that you don't go to the future, you create the future. So she was very instrumental and invested early on. Recently, and I'm proud to say, and it hasn't even been announced yet, but Jerry Levin, the former CEO of Time Warner, who is very close to wellness, and he opened up a wellness sanctuary on the West Coast, is joining our board and investing, and he believes in what we're doing and how big of a problem and solution we're bringing to market. Jason Finger, who started Seamless Web, and Linda Holliday, who founded Digitas Health, the largest pharmaceutical ad agency in the world. These are my advisors and investors. And Roger Ehrenberg and finally Wayne Kimmel, who funded Take Care Health before it was acquired by Walgreens, which makes the flu shots where you go into Walgreens and you can just walk in and do it. So what an amazing group of people. We had a summit a couple weeks ago where I brought them together and we sat for a day. No Blackberries, no iPhones, just talking about how we can take the platform we built, the expert we brought together, and do something meaningful to get to that next level. And so today, I'm not looking for capital from just any venture capitalist or any institution or any angel. I'm looking for people like Esther and Linda and Jason and Jerry who want to make a difference. Like I said, I've raised a lot of money. I want to be choosy and selective with only people who are batteries included investors, who believe in what we're doing, who have relationships and a desire to make sure that one day when the next person goes to the internet to do a search for information on something like a diagnosis with pancreatic cancer, doesn't need to do it alone. Thank you.